I think for a lot of women, as you just said, there's like this pulsatile component to testosterone in men. So they're kind of ready all the time, right? Like they're
Right.
just like,
Right.
hey, we can go right now. But for women, and I think that this is, digressing a little bit from just the physiological hormonal pattern, but for women, foreplay is all day long. It's like the dishes are done, or it's
Yeah.
like the little sexy test, like the little
Men, are
sexy,
you listening? The
yeah, it's
dishes
like
being
take,
done is
take some
foreplay.
notes.
Yes. Dr. Mindy in the house. All right.
I appreciate that.
The carnivore diet.
Because of what we eat.
Honestly, you've really touched my heart.
Here's where I want to start this conversation. I feel like you and I have very similar philosophical messages to women. And I have been interviewing so many women on this platform that aren't looking at their lifestyle mantras or their lifestyle approaches and mapping that to her hormonal cycles. So I really want to start this conversation off with a thank you to start with. Like, I just am grateful to be having this conversation with you, and that more of us are trying to help women map exercise and food and all the things that we do in our life to keep us healthy, how we can map it to our cycle. But my first question to you is, why do you think we have this huge gapping hole in women's health as far as advice on lifestyle choices mapped to a menstrual cycle?
Oh, this is a good place to start, man. All right. So I'll say that, first of all, I think that with the work that you're doing, the work that I'm doing, I think in a few, hopefully it's just in a few short years that you won't even find any practitioner who is not willing to say, okay, we're going to create a plan for you, but first we need to understand what your menstrual cycle looks like. And I think that, for too long, it's been, we derive our protocols from evidence-based literature, right? Which is great. That's what we want. We don't want to be just pulling out numbers and things from the air. But there's a couple of problems. So first, most of the research traditionally that we find in PubMed and the literature at large as it relates to metabolism, as it relates to reducing obesity, type 2 diabetes, cerebrovascular, cardiovascular disease, all of these things, body composition, most of the test subjects historically have been men. And it's not that I don't think that there's been malicious intent here. I don't think that it's been like, what, these women, they're just too extra. But what has happened is that we have been excluded because our menstrual cycle presents a confounding variable to these very strict rigors that if you're doing, for example, a randomized control trial, all that you're doing is you're trying to manipulate one variable and see how that one manipulation is going to alter the two cohorts. So if you have a woman who is cycling, one of the any woman under 55, really, or whenever you transition into menopause in your early 50s, you'll find that she's different every single day of the month, right? She's got a different hormone, and over the course of a month, of course, that's how she runs through her entire hormonal milieu. So that in and of itself, from a research perspective, when you're just trying to change one thing, is changing, it's changing daily. So, you can understand it from in the strictest sense of, we really just want to see what happens when we fast, obese subjects, and we just want to look at what the outcome is going to be. And there is some literature on obese, like when we manipulate fasting as a variable, for example, or ketogenic diet, or whatever thing you're looking at, we do see a lot more abundant literature with obese subjects. But for someone with a body composition like you or me, or maybe has 5 or 10 pounds to lose, something like that, though that population isn't really studied. So if you're looking to look into longevity, how I can increase my lifespan, how can I increase not only the years that I live, but the years that are spent healthy, there's actually not a lot. So as it pertains to females. So that's part of the reason why I wrote my book, The Betty Body, which I'm sure we'll talk about a little bit today.
Yep.
But I think that that's, maybe a long-winded answer, but generally, I think we've generally been ignored. The protocols that we derive have been for men by men. And what we're finding now is that when women apply these things over time, we have very different
Yeah,
results.
we do.
Yeah.
Yeah, we do. So, okay, it's interesting because in just listening to you, I'm thinking, well, then it's near impossible for women to be studied because there's too many variables. And if it's near impossible for us to do research studies that are women only, then will we struggle to be able to get the attention of just, let's say, the medical community that is really driven by research articles to determine best practices and treatments?
Well, this raises this is an excellent question. And I think when we're looking at evidence-based protocols, if we just look at the definition of evidence-based medicine, it is taking what's available from the literature, which, to your point, we need more work. We need more studies that are looking at not only the menstrual cycle, but how, what the mitochondria, what are some of the changes in the mitochondria over the course of what are the sleep
That
pattern
would be
disturbances?
amazing.
Right.
That would be amazing.
So that we can control for those things. You can, in your statistical analyses, you can look at the mathematics and you can regulate for that. But that's not the only piece of evidence-based medicine. And I think that a lot of people really get stuck on, like, is it a double-blind RCT? And where's the meta-analysis for where's the Mendelian, but the other pieces to evidence-based medicine is you have the literature, what's available in the lit. The other piece is the clinician's expertise, which is often not considered. So is the clinician familiar, for example, with female physiology? Does she or he have female patients? Has she, in the clinical application of some of these protocols, has she observed patterns or things that are common, and can she control for them, or he control for them? And then the other piece of evidence-based medicine, which is almost never discussed, is the patient's goals.
Yeah,
So
so
when
true.
when you think of these three things, now you have an overlapping Venn diagram of literature, clinician experience, and pattern recognition, and the goals and dreams of the patient. It's not just what's available on PubMed.
Love it.
So yeah, that would be my answer to that. And then the other piece of it, of course, is I would just love to see more clinicians, more doctors listening to women and not dismissing them. Like, lack of evidence is
Amen.
not evidence of lack, right? Because there's not a double randomized control. That doesn't mean that this isn't true for this woman. So, yeah, that's sort of my views on that. Like, there's a
Oh,
lot more to evidence based than just what's available on PubMed.
Oh, I could not agree with you more. I have heard, and I'm sure you get the same thing. I have heard so many women who are frustrated, feeling unheard. And it starts in her doctor's office. And what unheard looks like is take this pill for the rest of your life. Or we see it with the menopausal women. You now are gaining weight just because you're going through menopause, or maybe your problems all will be solved with an antidepressant. And that this has to stop. This is not okay. And for me, what I feel like we've got to do is we have to empower each woman to be able to ask really good questions to her doctor or whoever is coming up with a health plan for her. So help my listeners understand, what would that look like if I walk into my doctor's office and let's say, get a bunch of thyroid tests done on me. And the doctor comes back and says, okay, you just have to take thyroid medication. That'll solve your problems. What kind of questions can I ask my doctor to get him or her thinking at a deeper level about my hormonal needs?
Oh, this is good. This is going to be a fun podcast. So It's gonna
I'm
be
a
a fun
deep thinker.
conversation. Yes, you are. You are. So I think even before we get to that, it's necessary to go just one more step up. And that is to understand when you are going to any type of practitioner, whether it's a medical doctor, a naturopath, a chiropractor, an osteopath, whatever regulated health professional you are going to, you have to understand what their philosophy around health is, because that is going to be a big predictor of the types of interventions that are going to be recommended to you. So, and this is changing, but generally we see more allopathic physicians, more conventional physicians who have been sort of, born and raised in the medical establishment, what I would probably call more there's consensus medicine, which is maybe an entirely different topic, but they are very likely going to give, as you mentioned, a woman who's perimenopausal or menopausal, she's going to be put on the pill, she's going to be put on the statin, she's going to be put on, she's going to be put on all these, like the pill when you're perimenopause. It's like, are you kidding me?
Right. Well, anytime. Or what about when you're 15 and, this
Right.
will solve all your problems, your
Right.
hormonal problems. That's a whole
Right.
problem.
That's a whole, that's a whole other beast, but
Right.
yes.
Exactly.
So you have to understand what type of response you're most likely to get from, for example, an allopathic physician versus more of, what's called CAM, right? So complementary and alternative medicine. So that you might see chiropractic under there, naturopathy in there, osteopathy sort of, kind of as a switch hitter sometimes, depending on where you go. So, you sort of have to understand generally the philosophical underpinnings and premise of that practitioner, and that's really going to help you predict what kind of outcomes you're likely, or what kind of answers you're likely to get from that practitioner. Now, if you are going in, let's say, to your conventional GP, your primary healthcare provider, who happens to be a medical doctor, and there is a script that's written for you. So maybe it's the birth control pill, maybe it's a statin, maybe it's, whatever it is. I would really want to try and get an understanding of the risks as well as the benefits, because one of the things that I see and this is not, if you understand the risks and you still make the decision that this is a good intervention for you, then do it. But I think more often than not, and this is what I think you were referring to earlier, when women feel that they're unheard, that they have been rushed through these appointments, is that the medical doctor has not adequately explained the risks. And I think as a very fast-paced modern society in general, you can't just blame the medical doctor for this. Like, the patient will go in saying, like, I want something fixed and I want it now. Like, I need you to do something for me. Like, this is unbearable. So it's sort of a dance between the willingness of the patient to say, okay, have I mastered some of these foundational lifestyle interventions? And if I have, and I'm still in need, then maybe there is an intervention there from your GP. And I would also, as a doctor who spent 16 years in private practice, give your doctor the heads up that you want to have this bigger conversation. Because I would have, I sort of, the way that I used to structure my day was I would have a certain allocation in the day for a new patient or report of findings for, like, these are longer appointments. And then I would have shorter appointments for body work. Body work doesn't, once you've mastered adjusting and rehab, like, it's not as big of a time, intervention. So if you have someone who's coming in for a 15-minute appointment and you're like, hey, I have 7 questions, I need to ask them to you right now. Like, the doctor is going to be like, I have 30 people in the waiting room. Like, I can't do this. So I would call the office ahead of time and say, hey, you know what? I have some questions that I would like to ask my GP. Can she or can he set aside some extra time for me when I come in on Thursday? Or if
Love
that's
that.
not possible, next week.
Yeah.
And so when you do have that appointment where the doctor is expecting you to have some of these more elaborate questions, you really want to understand what some of the long-term consequences of taking medication might be. And, with PubMed now, it's relatively accessible to most people. Like, you can kind of do some of your own due diligence. Like, it's your health, right? Like, you have to help come to that decision with the coach, with the guidance of your medical doctor or your primary, whoever you're speaking to, but really understand what the risks are. Cause I think, as a society, we attach ourselves, like we get married to the allure, right? Of the
So true.
promise, right? It's like, oh, I'm going to have no symptoms. I can have sex without condoms. I can, and then, but then we divorce ourselves from the risks, right? And when I talk
Mm.
about sex without condoms, I'm referring to the pill, but we don't
Mhm.
talk about, upping inflammatory pathways. We don't talk about, killing libido, about vaginal atrophy. We don't talk about any of those things. So really understand what you're playing with, and then when you understand those risks, say, okay, am I good with that? Like, am I okay with that?
Right.
And if it's a yes, then go ahead, you've made an
Uh,
informed decision.
Yeah, I love that. The block that I see happening for a lot of women who would go with that approach might be where the doctor dismisses the downside. There's a lot
Yeah.
of that where the
Yeah.
doctor's like, "Oh, there's not a lot of risks at all."
Hmm.
And so then do you ask to see, like, can you point me towards some research? Do you have to go look at the medication you're taking? What do
I
you
think
do
it's
if
just as
you're
simple as like, cool, well, can we read the insert together? And
yes.
can you explain what some of
Yes.
these things mean? And do you think that this is applicable to me, given that maybe my labs, my history, maybe I have a long-standing rapport and relationship with this doctor, like, and maybe it is very low risk for that patient,
Right.
maybe
Right.
it's the doctor is absolutely on point with that.
Yep.
But it's not just the doctor's responsibility to
Yep.
make that decision. It's also, as I was talking about with evidence-based medicine, it's the clinician's experience, but it's also the goals and the dreams of the patient.
Yes. I love that.
Yeah. So I would say, if the doctor is very dismissive, it might be that they're right. Maybe that it isn't that big of a deal for you, given your history, given your familial, if you have no history of familial, hypercholesterolemia, or, and if we're talking about statins or whatever, maybe it's completely fine for you. But
Mhm.
maybe when you do your own research on PubMed, you might come to a different conclusion, and you should
Mm.
feel comfortable enough to speak to your primary and say, well, what about this? Like, this concerns me.
Mhm.
And I think generally, in sort of Western society, we say, the customer is always right. And I think that the patient is usually right. Like, heal thyself, doctor. Like,
Yes.
your intuition is always going to be better, right, than mine. I
Yes.
can use data to conclude and to come to a logical, inductive reasoning or deductive reasoning. But if the patient's worried about something, it's our obligation to address that with them.
Yeah.
And if they're not
And
willing to, get a new doctor.
Agreed. And what I always tell my patients is what you're doing in the act of what you just explained is you're actually training your doctor to start to think at a deeper level. So if that doctor starts getting multiple women coming in and saying, "Tell me the risks. Is this something I have to be a medication I have to be on for the rest of my life?" When we start those conversations over and over and over again, there becomes this opening that starts to get the good doctors, hopefully, to think a little deeper and see what the needs of the patients are. But when we go in, we dump our symptoms out, we're given a prescription, we walk out, and we just accept that, then we haven't helped the doctor see what we're needing. So I'm all about creating collaborative conversations. How do we bring all these amazing doctors and healthcare professionals together to benefit women? Which is why I love books like yours and discussions you're having and I'm having about, okay, women, we have to do this different. And I love that we've started this with, it starts with how you communicate with your doctor. That was what doing this different looks like. And I hope the women listening to this are grabbing that. Before I dive into things like, I want to talk about exercise around your menstrual cycle and some of the fun things that you and I will enjoy geeking out on. Let's help women understand, why does a woman need to think differently about her health than a man? Like, let's go to the basics, because I'm sure you're finding this. So many women have no idea about her hormonal cycle, are so out of touch. We have no idea we're supposed to be doing things differently than men.
Yeah. Yeah, that's actually one of the big reasons why I decided to write the book. So I was doing a presentation to these like 7 and 8 figure female entrepreneurs. I was invited to speak, and the topic of the presentation I was giving was how to use your menstrual cycle to make $1 million. So that was like the
Oh, I
fun,
love it.
title, right?
I love
And
it.
so these are very successful women, right? These are entrepreneurs, intrapreneurs, like CEOs of companies and whatnot. And these women have gone through every, business growth, like any type of training that you can imagine to sort of get at a competitive edge. Like these women have, been exposed to in some capacity. And so I gave this presentation. It was supposed to only be 90 minutes. And I was the last, pardon me, it was only supposed to be like 45 minutes. And I was the last speaker of the evening. And then what ended up happening was this like 2 hour Q&A that followed. Like, what about this? And what about, like, these women had not been exposed to what is a normal menstrual cycle, first of all, versus what is a common symptoms that we experience. And I know that you talk a lot about this, the difference between normal, which is,
Yep.
physiologically normal, supposed to happen with predictability and repeatability, versus commonly occurring in the population, which people often conflate. We
Yeah, they
often
do.
mix up. Well, I get common headaches. I get common pain. We've especially around our menstruation, menstrual cycle pain has really been normalized. And you see this in
Yeah.
advertising, right? It's like, just take some Midol, just take some, take a day off. And, while there should be some cramping, right? Like your uterus is contracting, you're shedding an endometrial lining. It shouldn't take you out. Like you should still be able to do absolutely everything that you would do any other day of the month. So so that was one of the big, like, okay, these women don't know. That means that, like, there's a vast majority of women that haven't seen a graph or even explained what their menstrual cycle has been since high school, right? And even then we were probably like putting our hands over our ears going, oh my god, make it stop. So
Right.
I think that for women, when I train about how women are different than men, I often will give the parallel that men are like the sun and women are like the moon. So when we think about men, they will go through their entire hormonal milieu in about a 24-hour period. They will cycle through their testosterone and estrogen patterns in about a day. And for women, we will cycle through our testosterone and estrogen and progesterone and LSH and FSH, like all of our patterns, not in a 24-hour period, but in about a 28 or 29-day period. So, and that's what we refer to as your menstrual cycle, right? So it's all very similar to the lunar cycle, right? So the lunar cycle, the moon cycle is about 28, 29 days. And so it's important for us to really distinguish ourselves from men in terms of our daily rhythms, because we are different every single day versus men who are different at different times of every day, but
Yep.
generally they are the same every day of the month. So, the first thing that we really need most women in their reproductive years to be understanding is that distinct physiological difference of our reproductive cycle. And for them to really start tracking, like to start tracking and amalgamating data on what it is that happens for you, particularly, like getting data on what's the length of your cycle, how long is your bleed week, what happens in your bleed week, what's the color of your blood, the flow, do you get cramping? Are there clots? Like, what's the color change over there's so many things that you can start aggregating when you start tracking your cycle. And then you can start overlaying that with nutrition and exercise and sleep and stress reduction and supplementation. But it really only, it's really kind of useless to think about being cyclical when you don't have any data on your cycle.
Yeah,
So
so well said.
yeah.
And I feel like this is a concept that we need to teach every 13-year-old girl.
Oh yeah. Oh
Like,
yeah.
why are we learning it when our hormones are a hot mess? Why don't we learn it in the beginning so that our hormones never become a hot mess? Tell me what tracking device you like, because there's a lot of good ones out there. And a lot of our listeners are menopausal women. A lot of them are postmenopausal saying, "Well, I should have done this years ago." But
Mhm.
they also have an influence on the teenagers growing up and the 20-year-olds. And so one of my mission cries has been, as you learn it as a woman, you need to turn around and teach it not only to other women, but we need to go down and teach what you just said, this concept of us. I love the moon analogy of our hormonal swings happening in let's just use 30-day cycle. We need to know that from the beginning. And I love this idea of tracking. So
Yeah.
what do you have a tracker you recommend, or how do women go about doing
Oh,
that?
there's so many. I use Clue,
Yeah, me too.
CLUE, super
Yeah.
easy. I have the free version, and it's just, when your period starts, you enter, is it light? Is it medium? Is it heavy? What's your
Yep.
skin look like? What's your sleep look like? What's your energy look like? And then you can go back as you're tracking, you can go back in the data and say, okay, so my sleep tends to be disrupted around day 25. I have a really heavy periods the first couple of days. My energy levels look like this during the month. So there's so many of them. I have gosh, like you just have to go into the app store. Like Clue
Yeah,
is
I was
my
gonna say
favorite.
Clue's
Yeah.
my favorite too. It's the
Yeah.
easiest. When I first started using Clue, the Clue app in my early 40s, I was like, "Oh my gosh, it has such a cool visual." I
Yeah.
was like, "I should probably send this to my husband so that he knows where I am,
Yeah.
and maybe even my staff so they know like where,
Yeah.
because it has that little fuzzy PMS period time." And
Mhm.
I was like, "Oh, this would be really helpful if you understood where a woman was in her cycle. You
Yes.
may be able to relate to her different. You may be able to understand her different. You would definitely know when her libido is at its peak. It's a really cool visual that they give.
And even just from a business perspective, I love that I wish I could share this with my team members, because
Yeah.
there's times of the month where you are much more articulate, right? There's
Yes.
times of the month where you have estrogen just like bathing your verbal, your verbal centers in your brain
Yep.
around speech. So there's times where you should be, recording a podcast like this, for example,
Right.
like speaking, publicly, giving a presentation, asking for a raise. Like there's so many great little hacks in terms of how you interact with your cycle and your career. Like that's another layer that you can
Right.
really play with as well.
Yeah, but why aren't we taught this? It's like I'm 51 and I'm like, why am I just starting to put this into place? As I went through menopause, that's how I started to discover it, because I wanted to understand what the missing hormones, why were they making me feel so weird? And oh my gosh, well, was it supposed to do? And it was a whole awakening for me in my 40s that I want women to have when they're 13.
Yes.
So that's why again, I love concepts like, let's just start teaching them to track.
And for the 13-year-old girls, like any moms that are listening now for their 13-year-old, 15, 17-year-old daughters, also, this is like 16, 17, 18, shout out to my colleague, Nat Kringudis in Australia. She talks a lot about, this time, 15, 16, 17 years old, where your cycle becomes irregular. It is actually
Mm,
part of your maturation where you
yep,
kind of start to look a little PCOS-y, like, polycystic ovary syndrome-esque.
yep.
You become infertile, maybe you miss a period. And then, the mom is concerned, the daughter is concerned. They go to the doctor and they usually get a script for a birth control pill at that
Mhm.
time. And
Right.
so, if we knew that, hey, just expect that, in your early menstruating years, just like when you learn a new skill, you're not going to do it right, right. You're not going to just ride a bike when you're, a newborn. You got to learn. You got to learn a couple of like preliminary skills before you can walk and run and get on the bike and have balance and all that. So it's the same with our early menstruating years. There's going to be like little rough patches, and just know that those are normal. That's
Yeah.
not, there's not something abnormal with you. That's just, the maturity of your reproductive system.
Yeah, I love that. So walk us through, let's just say, I always say 30 days. I get, it's 28 for some, 34 for others, but let's just say, walk us through the hormonal changes that are happening in a 30-day cycle so we can pull the listeners up to speed. And then I would love to take that conversation and talk about, okay, how can we match exercise to that? How can we match the keto cycling that you talk about in your book? How can we match some of the everyday things that we're already doing? How do we match that to this cycle?
Amazing. All right. So this is going to be like a, quick back of the envelope menstruation 101.
Right. Exactly.
All right. So
Exactly.
there's four main parts, right? There's four main areas of your entire menstrual cycle. So we have, and I typically divide them into 4 weeks just for ease, 28
Mhm.
days, as you said, 30, 32, but just for ease, we're dividing these into 7-day chunks. If yours is a little longer, you're going to shorten these. If it's a little shorter, then you'll elongate them. So the first week, everyone knows popular girl, it's the bleed week, right? This is like when you can see what's happening. There's blood, right? This is the endometrial lining that has become ischemic, meaning that there's been no oxygen that's been derived because the week prior we had a dip in progesterone and estrogen, and now there's no pregnancy. Your body's like, all right, we gotta scrap this lining. We're gonna do it again this month. See if we're gonna have a potential for a fertilized egg. So the bleed week is, I categorize that as 7 days. Most people don't bleed for 7 days. You'll often find the average is somewhere between 4 and 6. But what you want to be paying attention to here from a hormonal perspective is you'll see estrogen is relatively low this week. Progesterone, she's gone. She's not really involved in the first half of the first 2 weeks of the cycle. The only hormone that really is around is something called FSH, or follicular stimulating hormone. And she's kind of holding down the fort. And what she's doing is as her name suggests, she's a she in my world.
I know. I love it. I love how you call it a she. It should be that. I love it.
So FSH is developing the follicle, right? So the follicle is the pristine, inside is the pearl, right? It's like the egg that we're trying to mature to release around ovulation. So, as I was saying before, a lot of things that you can be looking at this week. You can be looking at your, the quality of your blood. So, what's the color from start to finish? Most people will start off with like a deep red, and then towards the end of the bleed, it's more oxidized blood. We start to see it looking brown. But there are other variations. I talk about some of the variations in the book and what that means. You might want to look at the flow, like how heavy your flow is. And of course, you've only ever lived in your body, so you don't necessarily know what heavy is versus light. So I put some parameters again in the Betty body for you to look at. But some general things to be looking at is, are you changing your pad or your cup or your tampon, whatever, more than 2 to 3 hours in the first 2 days, more than 70 milliliters if you're measuring it through a menstrual cup. Is there clotting, right? Some clotting is normal. The size of the clots, right? So it should be less than a dime, over, like if it's like kind of the size of a quarter, that's too big, maybe some
Mm.
signs of estrogen dominance, which we'll get to today. So that's kind of week one. And so you finish the bleed, and then what's happening hormonally as we move into the week before ovulation. So week 2 is all about, now we're driving up. It's all about developing that egg. We want the egg to be mature so that we can release it, the follicle and the egg that's housed within the follicle. So hormonally, what's happening is we see estrogen peak. She makes her biggest and quickest apex in this week. So she'll go from, in week 1, we said estrogen's relatively low. I've seen labs that have been like 5-6 picograms per deciliter, all the way up to, moving into week 2, it can climax from like 5 or 6 to like 500 or 600 picograms per deciliter. So there's a huge
Yeah.
ski hill, if you will, when you look at it on a graph in terms of estrogen concentration. And we also see in this week before ovulation, we'll see testosterone as well. So testosterone, this is where we call week 2 like flirty, sexy, like you should be more interested in sex. Like
Yeah.
a crude measurement without, looking at your testosterone levels is, are you wanting to have more sex? Are you wanting to orgasm more? And that's Mother Nature's, insurance policy to try and get you to have sex so that there's sperm potentially around a couple of days before the egg is released, and then there can be fertilization, whether or not you want a baby. So
Yeah.
just,
Right.
this is a time if you want to get pregnant, lots of penetrative sex. If you do not want a baby, then, other things, right? Play with other modalities, other things.
Well said.
Um, so we so we come to about ovulation is about, call it day 14-ish. It could be day 12, day 16, but for most people, it's right around day 13, 14. The follicle releases the egg, and then the egg sort of waits around like the queen for the sperm to find her. Okay. So
I love your descriptive. It's like you could almost write a children's book on this.
maybe that'll be my next book actually. Is
Like you're telling me a
menstruation. Yeah.
story.
It's so funny. I was on a podcast several months ago and I was describing luteinizing hormone. So
Yeah.
I didn't mention it, but LH is, it also increases a lot in concentration in week 2, and it sort of comes up and then out, right? And I always likened it to like, whenever you go to like a family gathering, we all have that one, uncle or aunt who sort of barges in like middle of the dinner, comes in, is like, hey, what's up? Like hits you on the back and you're like, oh, this is kind of what LH does, right? It comes in like a whirlwind, causes the egg to be released. But these are the these are the ways that I remember them. So I teach them this way,
Super
right?
smart.
Yeah.
I love it.
So these 2 weeks in general are the follicular phase. So you were talking about, how do we layer in nutrition and exercise. So generally these 2 weeks you're much more attuned to restricting your carbohydrates. These are great weeks for keto, right? Great weeks for doing restricting the carbohydrates, maybe even the protein a little bit as well. I'll talk about some nuance when we get to it with week 2. But then when we move into the next 2 weeks, this is what we would call the secretory or the luteal phase of the cycle. So now the follicle has turned into the corpus luteum, right? So now there's secretion of progesterone. We see estrogen drop, and then she comes back up again, sort of week 3. And then towards the end of week 3 and the beginning of week 4, you'll see progesterone reach her peak. And this is a distinguishing factor of the luteal phase, is that progesterone is present. So when we think about progesterone, she is, she stimulates our appetite. She helps us, she has potent effects on the brain in terms of GABA neurotransmitters. So she helps us feel cool and chill and calm, but she also slows everything else down too. So you may find that you're bloated, that you're not having as many bowel movements as you usually do. And you're generally a bit more distended, right? So if you're eating a meal, you kind of just feel a little bit more gassy, distended, bloaty. So we have, progesterone reaches her peak somewhere around the end of week 3, beginning of week 4. And then if there's no fertilization at that point, what we see is the corpus luteum is, over the course of this luteal cycle is degenerating. And then the progesterone secretion stops and the estrogen stops. And you see this like nosedive of both of these hormones. They come down together, crashing often together within a day or so. And then this is often the time where PMS, if you have a tendency to feel more inflamed, if you have a bit more of metabolic dysregulation and dysfunction, you're going to look a little bit more like you have that metabolic dysregulation during this time. You're a bit more insulin insensitive.
Yep.
And the PMS, the moodiness, the sleep disturbances, all of that happens here. Yep. And then eventually you bleed, right? So eventually the endometrial lining is not receiving that progesterone anymore, becomes ischemic as we started off in the beginning, and then the cycle starts again.
So beautiful. I swear there needs to be a kid's book.
I love that.
Or like a teenage book that, a lot of conversations I've had with functional medicine doctors recently has been about our own personal experience of health education that we got or sex ed that we got when we were in the 7th grade. Mm-hmm. And it was
for me, it was a banana and a condom, and we were all like, oh God, get me out of here.
And it was you're bleeding now, you can get pregnant, here's how you manage your blood. Right. And like that explanation you just gave, like should be in some kind of pamphlet or book that every girl gets so that she understands that. And the two of the points that I really started to tap into in my own cycle, as again, I went through menopause, is where it started to rear its ugly head. One is this thought that testosterone for women only kicks in at one part of that 30-day cycle. For a man, it's surging every couple of hours. So, in our relationships, now we're just assuming in a heterosexual relationship that you could be an easy mismatch, and there may be you may need to explain to your partner when your testosterone is supposed to kick in, and have a discussion about how he's getting it every couple of hours and yours is coming once a month. That sort of was my first interesting aha. Now, if you're in a same-sex relationship, you can also be mismatched and have testosterone coming at different times. But this mismatch of libido, I feel like based off of hormones coming in, could be a marriage saver, it could save so much heartache if we understood our partner's pattern of libido based off of the testosterone rushes.
Yeah. And I think for a lot of women, as you just said, there's like this pulsatile component to testosterone in men. So they're kind of ready all the time, right? Like they're
Right.
just like,
Right.
hey, we can go right now. But for women, and I think that this is, digressing a little bit from just the physiological hormonal pattern, but for women foreplay is all day long. It's like the dishes are done, or it's
Yep.
like the little sexy test, like the little
Men,
sexy,
are you listening? The
yeah, it's
dishes
like
being
take
done is
take some
foreplay.
notes.
That
Or
is like, that was golden there. I hope every man heard that.
or, you know what, honey, I thought you might be hungry, so I ordered you some, like any,
Right.
if you can feed, you can predict when your woman is hungry, you are going to be getting so much sex. But I'm just,
Yeah.
I-
And a foot rub would probably work too.
exactly. So foreplay for women, I think, happens all day long. It's not just at the end of the day or the beginning of the day or whatever. It's the interactions that we have with our partner. So I like that, having an understanding of the differences in our testosterone and our estrogen patterns, because men and women have both, just in different
Mhm.
concentrations and different patterns, as you mentioned. But also, when we think about what turns on a woman, it's like with the dishes being done,
Yeah.
or like, you know what, honey, don't I got this. I'm going to put the kids to bed. Like you go and, you do your oral care. Like I'm just referring to my own husband, because I love to do this like really elaborate oil pulling and like thing that I like to do. So if if he's putting the kids to bed and I have time to do like my brushing my teeth and then the flossing with the essential oils and the oil pulling, and then I get to put oils on my body, like that is how I actually, in many ways, like, get into the mood for
Yeah.
when the boys are like in their bed and he comes in and I'm all like oiled up and feeling good and ready to go.
Yeah. Oh my
So,
God. This is
yeah.
like golden. This is, I hope men are listening. So, okay. And then my other like aha in understanding hormones that I think women should grasp is this week before our period.
Yeah.
This progesterone, I have a chapter in my book called Dear Progesterone, I'm sorry I took you for granted,
Mm,
because I feel like I had no clue what progesterone was doing for me until I moved through my 40s and it went away. As to your point, she went away. And
mhm.
as she went away, I was like, why can't my body relax? Why am I not able to sleep? There were so many things that I realized, why do I all of a sudden have anxiety? And I don't really understand this. So when we are feeling like slowing down the week before our period, when we're feeling like we want more carbs, when we are in more of an introspective mood, I want every woman to know that's okay. There's a physiological explanation for that.
And that's a really important time in your cycle. So I will often talk about this idea that when we see progesterone and estrogen taking that nosedive, right? So that there's no fertilization, the endometrial lining is about to become ischemic and we're going to shed it. This is when we as women tend to move into, what I would call a negativity bias.
Mm,
So, everything annoys you, right? Like your kids annoy you, your husband annoys you, your job annoys you, you can't pick the right nail polish, all your clothes are like the worst, and but that is such an important part of your cycle not to be disregarded, because that is your body asking you to look at the parts of your life or the people and the relationships that you have that are not working right now.
mm, mm,
How is the parenting relationship not working right now? How is your relationship with your partner not
mm,
working right now? How is this career? how is your boss or the career that you've chosen not serving your soul? This time, this like 3 or 4 days where you're weepy and you're like everything is wrong, that is your soul saying, these are the things I need.
I
These are the
love that.
things I need. And I think we generally want to ignore it. We want to push through it.
Yep.
And I've seen memes on the internet where it's like, last week didn't make sense. And then I got my period and it's like, oh yeah, right. But
Yep.
if you say, okay, I know, like if you track your cycle, you know when that's happening, first of all. And so what's coming up for you emotionally, pay attention to that. These are
Yeah.
the whispers from your soul. That's like, this is what I need you to do for me, girl. Like, this is what we need to be
Love it.
focusing on.
Yeah, and it's kind of like fasting. We do a ton of fasting with our group, our resetter group, and I always say when you get that agitation or that thought that pops in your head when you're 17 hours into a fast, it's an opportunity to understand your belief around food and how you use food. And I had never thought about that with that week before your cycle. So that was incredible. Yeah, well said. And again, I hope everybody's taking notes and listening to that. So now that we've done a basic understanding, MAP, exercise, you already talked a little bit about keto. Exercise is a huge one. And, as a former competitive athlete, I also had to learn that as I moved through my 40s, yoga was going to benefit me a lot better than trying to run a marathon. And I love how you map exercise to your menstrual cycle. So talk a little bit about that.
Well, first, let me say that the type A personality in me honors and loves the type A personality in you.
Thank you.
Because if you are a competitive athlete, you are competitive with yourself, you're hard on yourself. And what tends to happen is you tend to put your head down and punch out the workout, even though you don't feel like it. And
Amen.
yeah, and what often happens is I'll have women come to me and say, I don't know, I've been doing like 5 of these like hit training workouts, this week, and I've been doing it for like 4 or 5 months, and the weight keeps creeping up, and my belly fat is going up, or I can't seem to get rid of this belly fat, and really this is a cry from your body, because if you are
Mm,
doing that much high intensity, like I love hit training, right? There's a time and place for it, and we'll talk about how there's times in your cycle that you should not be training hit. We'll talk about that in just a moment. But if you are constantly working out as if you are about to die, like if your heart rate needs to get to like 170 every time, that's not appropriate. You're sending this stress signal like, hey, every day I got to run away from a tiger to save my life. Like I got to hold on to some fat, like a bit of an insurance policy here, because
mm,
this is not a safe situation for me. So, with that said, I think that I'm a really big fan of resistance training. I think that it trains your resistance. So it makes you harder to
mm.
kill. So whatever pandemic and whatever virus and whatever mutant and variant, and the better and more muscle mass that you have, the more, generally speaking, your immune system is going to be healthier, your metabolism is going to be healthier, your mood, your energy, all of these things are going to be ameliorated. But I would say that the way that you resistance train and the way that you apply your cardio should change through your menstrual cycle. So, for example, um, training with heavy weights, I think, or moderate weights, I think, can generally happen all through the month, but you're best suited for moderate. And when I say moderate, I'm saying somewhere between, call it 8 to 12 to 15 reps. Okay. So whatever that number, whatever that weight class is for you is going to be different for everyone. But generally, you should be able to punch out 3 or 4 sets of 8 to 12 repetitions. That is really well suited for your bleed week. So, obviously, the first day or two, a lot of people feel quite lethargic. So, if that's you, go for a walk, Pilates, yoga, as you said, spend some time in nature, a lot of cross crawl stuff. So, the walking is really
Mm.
good for the corpus callosum. Really, really love that for day 1, day 2 of your bleed week. But then once you kind of get into the rhythm of your period, I think it's appropriate for you to start lifting moderate weights. As we move into week 2, so you stop the bleed, now you're in that pre-ovulatory phase. As we said, testosterone peaks here, and so does estrogen. So these are 2 anabolic hormones, meaning that they are growth hormones. So this is a wonderful time to profit. This is the one time that testosterone is going to have this big peak.
Yes.
So
Yes.
you want to profit from that by lifting heavy weights. And when I say heavy, 5 to 8 reps. So that means that the weight class is going to jump. You may need a spotter, but you should be, the last 3 repetitions should be incredibly difficult, and you should only be able to do somewhere between 5 and 8. This is also a time for you to stay away from high intensity interval training for the exact reason why you should be doing heavy weights. So, as estrogen comes really high in this pre ovulatory phase, what we know about estrogen in terms of its effects on the musculoskeletal system is that it makes our ligaments more lax. So, when we say ligamentous laxity, that's just like a fancy word for loosey goosey, right? Like your ligaments are loosey goosey, and it makes your tendons stiffer. So, stiffer tendons, I mean, obviously there's a continuum. We don't want them so stiff, but when they are stiffer, then you can lift heavier weights because now, let's say if you're doing a bicep curl, as you are contracting the bicep muscle is going to be pulling on a stiffer tendon, which can pull on the bone. So you can actually take your weight up this week. But with burst movement, with explosive movement, with
Mm.
high intensity stuff, you are setting yourself up for injury if you're doing HIIT training here because of those loosey goosey ligaments. When you do any type of burst movement, so if we think about like a burpee or a sprint, or even if you're doing like a bike ride, and then the instructor says, okay, like everything you got for 30 seconds, or an all out balls to the wall, like 45-minute sprint or 45-second sprint. You are the tension that you are putting through these ligaments, particularly I'm talking about the knee and the shoulder. These are two very joints that are very susceptible to injury. You will injure them this week. Like you will tear
The
the labrum.
second week. We're in the
Second
second
week.
week.
Second
Yeah.
week.
Okay.
So you'll tear the labrum in the shoulder, you'll rupture the ACL. And we actually see this in the data when we look at the propensity of where we see the most injuries in women when they are not menopausal. So when they are in their, reproductive years, it tends to be ligamentous injuries. And then when
Yeah.
we transition into menopause, we actually start to look more like the guys in terms of our injuries now are not ligamentous in nature as much, but they move more now towards muscle strains because we don't have the ligament, we don't have the estrogen making our ligaments loosey goosey anymore, or at least that high fluctuation.
Yeah.
So stay away from
Love that.
this week. Yeah.
Yeah. Okay. So then what about when you move into the week before and progesterone's high? Is that a time we want to change like hardcore marathon running, or, progesterone's so susceptible to any increases in cortisol? Is there something we should do different that week?
Yeah. So when we're thinking about the luteal phase, so week 3 and 4. So now if you look at estrogen, we see a bit more of a sustained release of estrogen. So high intensity interval training is completely appropriate in week 3 and 4. But a lot of times in week 4, we don't feel like it, right? Like
Right.
we're like kind of like achy and inflamed. So in terms of the resistance training, I like to actually bring down the weight, but increase the repetition. So you're still bringing the muscle to fatigue, but you're doing it in a slightly gentler way. So you
Mm.
bring the weight down in terms of the weight, the absolute amount of weight that you're pressing or pulling. And then you are maybe now doing 15 or 20 or 25 reps. So you're still working the muscle, but now it's really more of like a flush. Like you're kind of flushing, trying to flush out. You're
Mm.
getting the myokines that are being released, and now you're going to be reducing inflammation.
Yep.
And if you're someone who is very stressed, so this is all women until proven otherwise, right? If you are someone who has had
I love it.
long-term chronic stress that includes pregnancy and child rearing, sleep disturbances, which we know happens when we're mothering our young children who don't yet have a circadian rhythm that's established. You're taking care of aging patients or parents rather, and there's all the things that happen with life. It's important for you to be gentle with yourself. I think so
Mhm.
many women were like, no, I set out today and I'm going to do this thing and I'm going to do it. And like, these are my type A Betties. These are like the Betties that are like, no, I'm going to do it no matter what. And
Yep.
this is when you hurt yourself. So first of all, you're pushing your body. Your body's always smarter than you. Like your body, if you just listen to her, She's always smarter than you. If you need to modify your workout or, your eating patterns, particularly in that week 4, right? I actually love, as you said, increasing the total amount of calories, increasing the total amount of carbohydrates. You need it. You're building an organ. But if you don't have that flexibility of thought, you're like, no, I need to stick to this one diet. I'm going to do it all the time. It's,
Yep.
Vegas or bust, then you're going to bust. It's like,
Yep.
it's with this all or nothing thinking, we usually choose nothing. So
Yeah.
I'd rather you just modify it a little bit so that it's easier. It like health doesn't need to hurt, like being gentle with yourself and having the grace and the wisdom. I mean, if you're 40 or 50, like you're a smart woman. You've had to get through stuff, right? There's been a lot of trials and tribulations. So being able to just go in a little bit and say, okay, girl, like, what do we need today? We need a
Yep.
walk. Okay, let's do a walk. We're not,
Yep.
we had planned for the 10 mile, whatever, but today we're going to do a walk. We're going to listen to a podcast. I'm going to go to the woods where I can get some of the trees. And that's what I'm going to do today. And I'm good with that.
Yeah. Which is really hard for the type A woman.
It
I mean,
is.
I will say that was my huge lesson in my 40s, was giving myself grace to say, I planned this workout and my body is telling me I need a different thing to do. I need to get out into nature. I need to sit on the couch. I need to do yoga, because the way that my brain had always thought of that is I was being lazy. And
Yeah.
when I got
That is a
into my
patriarchal construct. That is a patriarchal construct, that our to-do list is our worth. So
yeah,
every type A person that's listening to me, trust me, I have been there. I am still there in many, like many
yeah,
days, that
yep,
drive to achieve is very much baked into my DNA. But it is the wisdom of aging, in some ways, where we have knowledge is useless if it's not integrated into wisdom. And you
yep,
can know like most of us know all the things, right? We know fasting helps with our hormones. We know we need to prioritize protein in whole foods. We know that we need to move more, but it's the gap between knowing and doing. And that's the wisdom
yeah.
piece.
So well said.
Yes. So it's the wisdom of saying, okay, like I know that, doing a really heavy leg workout was on the schedule today, but I don't have it. I had a bad sleep last night. I'm really stressed at work. Something's happening with my kid. Like I'm just going to be gentle on myself. This is where we can move. That's actually how you'll get way more results, because this, doc, that like all of your results, it doesn't happen in the gym. It happens when you recover.
Yep,
So we're talking about muscle gains a lot today. Your muscle gains don't happen in the gym. They happen when you
yep,
take a couple of days off and you allow for the metabolic and the mechanical stress that you put on those muscles to heal. And that's
yeah.
when the hypertrophy and the strength gains and the power and the explosion gains happen.
Yeah, so well said. Okay, what does the perimenopause and menopausal woman need to know about if your cycle is hard to predict or you don't have a cycle?
Yep.
The postmenopausal women, our hormones are really going low. What do we need to know about diet and exercise for that time of life?
I love this. So I included this as well in the book. And I think that for women who are menopausal, postmenopausal, so you haven't had a cycle for at least a year, um, instead of following, the cues from your bleed week and ovulation and we don't have that anymore, right?
No.
So as I was saying before, men are like the sun, women are like the moon. I still think that menopausal women, just by nature of being a woman, we are cyclical creatures. So I like to follow more of a lunar cycle. So the lunar cycles, 28, 29, 30 days, depending on the month. And generally, the new moon is where we let things go. This would be equivalent to the bleed week in our
Hmm.
menstruating women. So the bleed week is where we can do moderate weights, we can do the keto, the waxing moon, which is, sort of the moon, the new moon, you can't see the moon in the sky. The waxing moon is sort of the crescent moon. And this would be akin to, the pre-ovulatory. So you can lift heavier weights during this time. You can still do HIIT training as a menopausal woman because you don't have that really high fluctuation. If there's like a Peloton class that you love, go for it, have at it. But heavier weights is really called for here. And then you're kind of cycling, right? So you're doing moderate weights, new moon week, the waxing moon, you're doing heavy weights. In the waning moon, which would be week 3 in your menstrual cycle, you come back to those moderate weights again. And then the week 4, which would be, or pardon me, the full moon would be your ovulatory
Right. Yeah.
moon, or sorry, your middle of your cycle. So this is again like the same thing. The waxing moon to the full moon is when we do those heavy weights. And then the waning moon is week 3, back to those moderate weights again. And then week 4 is the dark of the moon. So again, this is where we see that crescent moon kind of disappearing. And then, you're doing lighter weights that week. You're taking some recovery days, right? You're going for the walks, you're doing the yoga, you're doing the Pilates, you're doing I love to put some, podcasts in my ear and I go for like an hour or 2-hour walk. And that's how I would structure it for her.
Yeah.
I still like to cycle the keto. So I would do week 1 and 3, where she's doing more of a ketogenic specific diet. We know with menopausal women, generally, they tend to be more insulin resistant. So as we age, it's just a sort of a natural progression. As we start to see estrogen dipping, we also see our insulin resistance increasing. So 1 and 3 for week 1 and 3. So that would be your new moon and just after the full moon. And I like a higher protein, like weeks 2 and 4. I like higher protein in those weeks.
Yeah.
And we're doing that for our menopausal ladies also. And this is also true in our menstruating women, to profit to create more muscle. One of the things we want as menopausal women is we want our bone density. We want to be concerned about bone density and our lean muscle mass. So
Yes.
the more you lift weights, the more you are creating and preserving the muscle tissue that you have, but you're also directly influencing your bones. So your bones and your muscles, they're sisters. When one is dense, you have a lot of it, you have a lot of the other. And as you lose muscle, you will also lose bone density. And you probably know this, even more than I, but women who are osteopenic and then even move into osteoporosis, the one thing that tends to take them out is like a silly little fall or a
Right.
little trip, or
Yeah.
they fall on these, like we call them like foosh injuries, right? Like fall on outstretched
Mm,
hand injuries. And then you get this like fracture along a long bone, like you fracture the hip, you fracture the humerus, you fracture the femur, and then you can't do anything, right?
yeah.
Then you're out of commission for 3, 6, 9 months, which then has knock-on effects on your cognition and your brain health. It has knock-on effects on obviously your body composition, your mood, your energy, all the things.
Yeah. And I really hope that people listening are like, whoa, I've never thought of my workouts plan in accordance with my hormones. Like
Yeah.
that. I mean, when I was in college, I played competitive tennis and I had a bunch of injuries that I was struggled to heal from. And now I look back and I go, oh my gosh, if I had just been thinking about my workouts according to where the ebbs and flows of my hormones, I may have never even had those injuries that led me to surgeries. And then when you go into perimenopause and menopause, it's like, you're fighting for the motivation to work out and you're losing muscle. And you never think, oh gosh, in a 30-day period, I should probably time and change the way that I work out. This, I hope it becomes a common language, but I'm sure a lot of people listening to this are like, whoa, never thought of it this way. And I hope people are having that aha moment. Are you getting a lot of that from your book? Because
A
it's
lot of
just
it. Yeah, a
such a
lot.
great concept.
Thank you. Yeah, I mean, a lot. It's been really well received by the public as well as my peers, which is always really
Oh yeah.
important. So, but a lot of people are like, I never thought of it like that before, or I was always scared of doing keto, or I tried keto and it didn't work for me. And I was like,
Yeah.
well, you probably didn't do it like a girl, like
Right.
you got to do keto like a woman, in order for it to be sustainable for you. So we talk about what keto is for, a woman versus like the bacon butter burgers and repeat, which is often sort of like this dirty type of keto that we
Right.
see propagated in sort of, with keto experts. And as long as it fits your macros, it's like,
Right.
well. No,
Yeah,
no.
or
Yeah,
the
yeah.
keto experts say no, women shouldn't do it. We
Right.
actually came up with something called a fasting circle that does a 30-day cycle and looks at, I teach 6 different fasts, and it shows when you can use each one of these fasts according to the cycle. So I'm actually geeking out listening to you. I'm like, yep, yep, yeah, that's so I'm thinking as you're talking exercise, I'm thinking, yeah, that's when you can do this fast and that fast. And this is when
Yes.
you shouldn't fast,
Yes.
because we saw so on my YouTube channel, I got so many women who came from the hardcore fasting world and was like, my hair is falling out, I'm losing my cycle. And it was like, wait a
Can't
second.
sleep. Yeah, yeah,
Yep,
yeah.
can't
Yeah.
do it this way. So
I
I
love that
love
you
that.
have I love that you have different I talk about this in the book as well. There's different I sort of talk about like there's three levers you can pull with fasting. One is like the frequency, the type of fast, and then the sort of the severity. Like is it a water fast? Are you doing caloric liquid fast? Like is it a bone broth fast? Are you doing fasting mimetics? So I love that you talk about that because I think that most people assume that fasting is just either a dry or a water fast when there's so much nuance in terms of
So
how
much.
you can apply fasting as a woman, not
Yep.
only to your cycle, but to whatever your goals are. Like some people say, well, does a coffee break a fast? And does this break? I mean, I don't know if I find that's like the most like
Oh,
what
all the
breaks a
time.
fast?
I answer that question like 10 times a week.
Yeah.
I should have it tattooed on my arm.
Yes, exactly. And like the short answer is, well, what's your goal? You know,
Exactly.
Like, is it
Exactly.
digestive? Is it a digestive goal? Are you trying to heal the gut? Are you trying to lose weight? Are you trying to do it for clarity of thought? Like, what's the
Yeah.
goal? And then you can answer the question based on what your goal is. So,
Yeah.
yeah, love that.
Yeah, and exactly. I do a YouTube live every Thursday, and I get every Thursday I'm on there for an hour for my community, and I get questions all the time of like, what fast should I do for this and for that? And my always my response is, well, it depends what you're trying to do. What are you
Right.
trying to do? And I think a lot of the problem that we have is the one size fits all mentality that more conventional healthcare has taught us. We try to bring that to more alternative strategies, and there is no one size fits all. And then from there, we have to look at the fact that we're a woman and that we need to match it to our hormonal cycle, which is why I just love what you're talking about, because I'm over here talking about it. You're talking about it. I've seen a couple other women talking about it, and we need to amplify our voices so that women hear this and start to implement life differently and stop the suffering. It is time. We are no longer in a place where we need to do this like men. We need to do it like women, and we need to understand what that means. So I love this.
Can I get an amen?
Yeah,
Yes.
amen. Mic drop. Okay, last couple of things, and then I've got some questions, rapid fire questions for you. There
Sure.
was something that you put in your book, it was on Amazon when I was reading some of the things that I was like, whoa, what does she mean by that? And it was, you say that that our morning routines are sexist.
Yes, yes,
What
yes.
does that mean?
All right. I'm so excited we're talking about this. All right. So, yes, I proposed in the book that the way that we know morning routines are they're pretty sexist. So if you think about some of the, morning routine expert gurus, they wake up at some ungodly hour, like 3 o'clock, 4 o'clock, 5 o'clock, and then they have like a tea ceremony, and then they have like, ideation, and they write, and they'll read like like 30 to 50 pages, and then they'll go and work out for an hour. And then from there, they'll meditate, and then they'll do all these things. And it's like, okay, if you're able to do that, like, God bless, right? Like amazing. But if I were to wake up that early, first of all, as a woman, my sleep cycle is longer than a men's by at least
Mm,
15 minutes, but in some cases up to 45 minutes. So cutting your sleep cycles short is probably one of the most deleterious things that you can do to your
I love
metabolism,
that.
mood, energy, body composition. So no, break up with the 4 a.m. club, not good for you. But
Love
also,
it.
where are your kids? Like if I woke up and I was like, making tea downstairs, and then I was working out for an hour, my kids, like they need to be dressed and brush their teeth and get dressed for school, and like, so a lot of times when you hear these men talking about these elaborate morning routines, they usually have a wife, or if it's a woman, there's some help, right, that's doing some of the child rearing. So for women, and for me personally, I used to feel like a huge failure because I would see these guys and it's like, yeah, and I write for an hour and then I work out for an hour.
So well said.
And it's like, what's wrong with me? Why can't I do that? And it's
Yep.
like, because I have toddlers, because my
Yep.
morning routine was my kids like kind of, coming into my room, like, mommy, that was my morning
Yep.
routine. Like they're waking me up. And of course it's changed now. My kids are a little older. I have a 10 and an 8-year-old. So they sleep in generally on their own. Sometimes we get the odd nightmare, or if they're sick overnight, like I'm up with them. But for women with young children, you're already going to be sleep deprived by nature of, because they don't have circadian regularity yet. They don't have a circadian
Mm,
rhythm that tells them to go to sleep, every night at 8 o'clock or 7 o'clock. Like that has to be trained over several years. And of course, they also wake up multiple times overnight because of that.
yep.
So you already have these sleep deprived women that are trying, and we put so much pressure on our women to get back to the pre-baby body weight and get back, get
Ugh,
back, look at this,
yes.
look a certain way, 9 months up, 9 months down. And it's like, F you. Like I am breastfeeding. Like
Yes.
I breastfed my kids. My first child, I breastfed him for 18 months, which I thought was long. And then my second child, I breastfed him for 3 freaking years. Like he
Oh
could
my
not
gosh.
give up the boob. And I was like, okay, I just have to go. This is what my baby needs. And this is what I need to do right now for my children. So I had no morning routine for like close to 5 years. And I started off, as I think most women do, feeling like we're failures and why can't we do this like everybody else? And why, like, these are what the experts are saying, until you realize that the experts are men and they
Right.
have no idea. Like when in the book, I talk about consensus surveys, and I took data from Canada, the US, the UK, like, the Commonwealth and the Americas. And typically it's the woman who does the majority of the non-paid work. So she
Mm,
goes to her job, gets paid for that. But then she comes home and she does cleaning, she does laundry, she does homework with her kids, she stays up overnight, puts them to bed, all these different things. So she's working around the clock, but she's only getting paid for the time that she's, at her job. So it's completely sexist to expect that women are going to be able to cut their longer sleep cycles short and then also do all of these things without having their children interrupt them, because their little kitties have, needs that need to be attended to.
yeah.
So I talk about, okay, what are what are things that you can spread out, over the morning, right? Cold shower is one thing I propose. Like whenever you take the shower, last 30 seconds, even 10 seconds if you're not used to it. Like cold shower helps with reducing inflammation, helping with brain fog, and increasing mitochondrial biogenesis. That's one thing. We talk about journaling, or even just doing some type of gratitude. So it could just be that your toddlers come into your room, they wake you up, and then you open your eyes and you're like, I'm so grateful that I even had the ability to get pregnant and have these kids, because that's a present that's not afforded to everybody.
Yeah.
And then some movement. So the way that I used to get my movement with my kids is that we would put on, what did they used to, Thomas the Train. Okay. So like, they used to be obsessed with Thomas the Train. So we would put on that show tunes, like the songs that they had on that show, and we would dance. We dance in the morning, and that was my workout. I would just take them and we'd be like, I'd pick them up and we'd be spinning around, and it was like 5-10 minutes maybe before they got bored to do something else. But that was my workout. That used to be
Yeah.
how I got my movement in.
Yeah. So I'm thinking actually maybe men should do the parenting in the morning. Is what I'm
Yes.
actually thinking should
Yeah.
happen. But I
Yeah.
love your creativity. So I wish my kids are 21 and 18. So
Nice. Nice.
I wish I had known that, I had thought of that because I was also the woman who was, going to work all day, taking care of the kids in the morning, taking care of the kids at night. And there was that moment of just like, wow, this is 2 jobs, and
Yep.
it
Yep.
is a lot. And it is a hormonal destruction that can happen, is happening to so many women. So, okay, well, this is amazing. I could talk to you for hours, but I'm going to sum this up with 5 questions that just, doing some review on you and looking at your book, which I really want to encourage everybody to get your book. And we'll talk about how they get that in a moment. But here are my 5 questions for you. So obviously you love exercise. If there was only one exercise you could do for the rest of your life to keep yourself fit, there was only one, you couldn't vary it to your cycle, but it's this, what exercise would that be?
Sumo squats. Sumo squats, easy. That would be the number one. because it does everything, right? It does the
Awesome.
glutes, it
Okay.
does the
And what
legs.
is,
Yeah.
just so we know, what is a sumo squat?
The squat where your legs are a little further apart. Yeah. And then you come down and then you can either hold a bar, you can either put weights on your shoulder or you can
Oh,
also hold a bar as well. So you can do this with barbells, kettlebells, dumbbells, and you're getting your back, you're getting shoulders, you're getting abs, you're getting your entire lower legs. So sumo squats are my favorite.
okay. So second thing, if you could go back to your 13-year-old self and give her some advice, what would you tell her?
Oh, that's a good question. I'd just give that girl a big old hug. Like I would just, say, you know what, girl, you're doing the best that you can given, the life circumstances and the cards that you've been dealt right
Yeah.
now. And, you know, everything about you is beautiful. You're fine. You're not broken. And just keep going.
Yeah. That's how I feel about my 13-year-old self too. Like, gosh, I wish I could go back and give her some advice.
Yeah.
Okay. What book has had the greatest impact on your life?
Oh my goodness. What a question. Biggest okay, so there's a couple of them that I've read several times. The Alchemist,
Mm,
Paulo Coelho, I've read his quite a few times. The Art of War, I'm blanking on his
mhm.
name. The 50 Rules of Power and the 50 Rules of War. Robert Greene is the author. Am I only allowed to choose one? Is it just one book?
No, you can no, because this is you're creating a book list for people right now.
Okay. The Women Who Run with Wolves. That was a
Yes.
phenomenal book. And then The Heroine's Journey. What's her name? Margaret Murdoch, I believe is the author's name. A Heroine's Journey. We always talk
Okay.
about the hero's
Awesome.
journey, right? The Joseph Campbellian, like, the separation, initiation, return. But the heroine's journey is written. She was a student of Campbell, but she wrote it specifically for women. So I love I've read that book. I don't know how many times, like
Oh, those
10
are
maybe.
good. Yeah,
Yeah.
those are good recommendations. Okay, if you could spend the day with anybody alive right now, who would you want to spend the day with?
Hmm. Anybody alive? God, this is a hard question. Can I come back to it? Can I let my
Yeah,
conscious
yep.
think about it?
Okay, so
Okay.
that yeah, then my last question is if you had one message you could get in every woman's brain
Mhm.
that in the whole planet, it was like a two line message that you could help her see life differently or help her address her health differently, what would that be?
I would say that it's just like the Wizard of Oz. Everything you need to go home, you already have. Everything within you is already all there. So, it's really just about unhitching, yourself from the patriarchal sort of toxic society that we live in, where we think that achievement is related to your worth, but your worth is actually inside you. So you just
Mm,
gotta, click your heels twice to go home. It's a little bit more complicated than that, but it's the same principle
I
that
love
you're already who you are.
yeah,
You're already everything you need.
I love that. I love that. Okay, who are you gonna spend the day with?
Oh my goodness. Oh my goodness. I would say, who I would spend the day with actually? Diane Von Furstenberg. So
Oh,
she is the wrap dress. She's really well known for that. But she is, when we think about when she sort of came up in like the 60s and the 70s with this wrap dress, it was fashion and fashion houses were all very male, right?
mm,
And when we look at the difference between fashion houses that are men, we would see these like really, like very constructive, the models sort of were not unrealistic, but kind of unrealistic for like what the morphology of the typical woman is. And I think that von Furstenberg DVB's dresses were kind of the first that were like, we're going to use some fabric that is an everyday fabric, like a jersey that most women, like you're wearing jersey, I'm wearing jersey right now, that we feel the most comfortable in. And it was something that every body type could
mm,
could wear. And I think that I've listened to her talk on business and how she views the world and how she pushes when she needs to push, but she breaks when she needs to break. And she's an
amazing.
achiever, but she loves herself. And it's like, I would just love to have lunch with her.
Oh, amazing. Wouldn't that be it's just fun to dream about for a while, right?
Yeah,
There's
it's a
so
great
many
question.
so many wise women out there just to have a moment to sit and pick her brain. And it's just incredible. And we're so good as women of the gift of gab and connecting with each other. And it would be really cool to tap into some of those incredible women. So,
Yeah.
and I just want to tell you, this has been so much fun for me. So I really appreciate you coming on. And I have sat with that hormonal cycle for hours and hours and hours, looking at the science on fasting, keto, and really trying to understand how to map this for women. And then coming out of that discovery and realizing everything we do needs to be mapped to this. And there were moments when I first felt that I felt alone. Like, why aren't we talking about this? And then books like yours appear and people like you appear, and we just elevate the conversation, and we're able to help women see this differently. So thank you so much for your book. And please tell my audience, how do they find you? How can they connect with you?
Well, thank you. And let me just reflect back to you that it's been wonderful chatting with you. We are like, soul sisters,
Yes, we are.
we have very, very similar philosophy. So it's been a joy for me as well. So you can find the book is called The Betty Body. It has a bright pink, cover, me
I
on a
love
purple
it. It's
dress.
beautiful.
You can find this on Amazon, worldwide. In the States, you can also find it in Barnes and Noble. If you're in Canada, Chapters Indigo also has it. And when you do buy the book, I would invite you, if you felt so inclined. We've also created some bonuses for you because I like to treat my Bettys. So we've done nutrition, fasting, rehab, and fitness programs. So if you head over to bettybodybook.com, BETTY BODYBOOK.com. They're free there for you to download. So I would love to have you have the programming as well as an accompaniment to the book.
Yeah. Beautiful. Beautiful. Well, thank you for writing the book. And let's just keep screaming this, because
Yes.
women, if you're hearing this, please share this episode out. Get Dr. Stephanie's book, start the conversation with other women. Like, we just have to bring this to the attention of women all over the world. So thank you, Dr. Stephanie. Just keep shouting, but be sure you take some breaks too.
What happens in your bleed week? What's the color of your blood, the flow, do you get cramping? Are there clots? Like, what's the color change over there's so many things that you can start aggregating when you start tracking your cycle. And then you can start overlaying that with nutrition and exercise and sleep.